Thank you, Dr. Bhattacharya, for appearing before the committee. The National Institute of Health funds more biomedical research than any other public institution in the world. NIH's decades-long investment have helped the United States lead the world in addressing critical health challenges, helping us better understand heart disease, preventing and curing certain cancers, just as examples. It has also led to significant accomplishments like mapping the human genome, which is the foundation of many medical breakthroughs. As a medical researcher who has engaged in NIH-sponsored research for decades, Dr. Bhattacharya understands the power of these investments. And sir, if your name comes out just a little bit different every time I say it, I apologize in advance. Importantly, NIH grants have increased biomedical research capacities in states that otherwise would not have had sufficient resources to invest. My state, Louisiana, has received roughly $500 million through NIH's Institutional Development Award Program, or the IDEA program, allowing institutions to bring life-saving cures and treatments to people in my state and around the world. However, NIH, at times it appears, has prioritized funding for risk-averse incremental science. There's concern the current system incentivizes established scientists who study already proven concepts rather than younger scientists who have unproven ideas with potential as major medical breakthroughs. While this practice may ensure the short-term success of federal grants, it limits groundbreaking discoveries. I've discussed this with you, sir, previously and look forward to hearing more today. NIH is facing other serious challenges. During the COVID pandemic, there was a general loss in trust in public health and scientific institutions. To restore that trust, officials need to be more transparent and provide reassurance that they are publishing health guidance that is best for Americans' health and not biased in any way. You have indicated you would like to promote a free and open debate at NIH, including among scientists who disagree, and this is encouraging. The NIH is at an inflection point. It confirmed as NIH director, you'll be tasked with leading an agency that desperately needs a reform. Last year, I released several proposals outlining ways to modernize NIH, improving operations to better serve the American taxpayer. I look forward to hearing your vision today and working with you on these proposals if you are confirmed. With that, I recognize Senator Sanders for his opening statement.
Thank you, Mr. Chairman. Thank you, Mr. Bhattacharya, for being with us. Today, we will be considering the nomination of President Trump's nominee to be the director of the NIH, Dr. Jay Bhattacharya. The NIH, with a budget of $48 billion, is the largest funder of medical research in the world. This research has led to new treatments and prescription drugs that have significantly improved the lives of Americans and people throughout the world. And I think all of us should be very proud of those accomplishments. But having said that, let me say a few words about my concerns. I don't have to tell any American that the healthcare system in our country is broken and it is failing. We spend almost twice as much per capita on healthcare as any other industrialized nation, yet we have 85 million people who are uninsured or underinsured. We don't have enough doctors, nurses, dentists, mental health specialists. Not only is our life expectancy 4 years lower than other wealthy countries, the bottom 50% in this country live on average 7 years shorter lives than the top 1%. In other words, being working class or low income in America is in many ways a death sentence. You're rich, you're born, working class, 7 years younger. And very relevant to the hearing that we are conducting right now, we pay, as I think every American knows, the highest prices in the world for prescription drugs. No great secret there. In some cases, we pay more than 10 times of what our friends in Canada or Europe pay. In my view, not only has the federal government not effectively regulated the price of prescription drugs, but the taxpayers of our country have, over the years, provided hundreds of billions of dollars in research and development into new prescription drugs that have provided enormous benefits, financial benefits, to some of the most profitable pharmaceutical companies in the world. In 2023, when I had the privilege of chairing the committee, This committee released a report that found that the average price of new treatments that NIH scientists helped invent, NIH research over the past 20 years, is $111,000. In virtually all cases, American taxpayers are paying far more than people in other countries for the exact same medicine that the NIH and taxpayers helped develop. We developed the drug, and then we end up paying 10 times more than other countries for the drug that our taxpayer dollars helped develop. For example, Astellas and Pfizer charged Americans with prostate cancer over $179,000 for Xtandi, while the exact same drug can be purchased in Japan for just $18,000. We do the research, we pay for it as taxpayers, and then we get ripped off by the companies. In my view, we need an NIH director who is prepared to take on the greed of the pharmaceutical industry and use every tool at his or her disposal to substantially lower the cost of prescription drugs. Not a new issue, an issue that people on this committee have been talking about for decades. But with all due respect, Dr. Bhattacharya, President Trump will not be giving you that authority. I don't know what your views are on the subject. You're not going to have that authority. That authority will rest with Mr. Elon Musk. Over the past several weeks, it has become abundantly clear that it really does not matter who the president nominates to be director of the NIH, or and I don't mean to be disrespectful in saying that, but it doesn't matter who he nominates to be director of the NIH, or the Secretary of Labor, or the Secretary of Education, or the Commissioner of Food and Drug Administration. The real person in charge of all these federal agencies is Mr. Elon Musk, and that will continue to be the case no matter who the Senate confirms to these positions. It is my understanding that Mr. Musk and his minions at DOGE have moved to terminate some 1,200 employees at the NIH already, 6% of its staff. Further, I've been told that Mr. Musk and DOGE played a major role in freezing nearly all grant money at NIH, including grants that could lead to a potential cure for cancer, Alzheimer's, and many other life-threatening diseases. So, bottom line is that, in my view, the real gentleman we should be having up there, and again, no disrespect to you, sir, is Mr. Musk. And Mr. Chairman, I would hope very much, and I think the American people would be really very grateful if we could bring the real leader of the NIH, Department of Education, many other agencies of government before us, and that is Mr. Musk. So I will be looking forward to working with you to see if we can schedule a hearing with Mr. Musk. Thank you. As I mentioned a moment ago, in some cases we pay 10 times more for prescription drugs, the same drug that people in other countries pay. Something like 1 out of 4 Americans can't afford the prescriptions that their doctors write when they get sick. Why do we pay the highest prices in the world by far for prescription drugs, and what will you do if you are confirmed as NIH director?
I don't have a full answer to that question, but I agree with your concern and the fact that we do pay the highest prices in the world for prescription drugs. If I'm NIH director, if I'm confirmed as NIH director, I think there's a very specific thing that we haven't done, but we should do. The NIH should fund research on off-patent, off-label use of off-patent drugs, inexpensive drugs. I'll give you an example from the pandemic senator. There was a tremendous achievement, I think. There was a study done in the United Kingdom of a cheap steroid called dexamethasone, very early in the pandemic. If used during...
I don't mean to, I apologize, but I don't have a lot of time. And I hear what you're saying, and I'm not in disagreement with that. Question is, historically, the NIH has, as we all know, spent billions of dollars in developing important drugs. And yet, despite that taxpayer expenditure, we end up paying far more than other countries. Should a company that benefits from the taxpayer dollar research, basic research at the NIH, be able to charge any price that they want? Or should we attach to those contracts a reasonable pricing clause that says, hey, if we help develop this drug and it's effective, you're going to have to charge a reasonable price for it?
Senator, that's an issue where I think previous NIH directors have said it's very difficult for, as for an NIH director alone to take action. I think that's something that Congress and the administration would have to work together.
Not quite true. I think what we're learning from the president is a lot can be done through executive orders. And I would disagree with you. I think that's something that the NIH can do. Would you be open to that idea?
I mean, Senator, I guess I would focus on the future. Imagine the NIH focuses on support for relatively inexpensive.
Okay, I'm hearing a no. Okay, let me ask you this question. We talked about life expectancy, very important issue. Why is it that working class people in America live 7 years shorter lives than the rich?
Senator, it's the chronic disease crisis in large part.
But why does somebody who is working class end up with more chronic disease than somebody who's wealthy?
I mean, I think, Senator, that's something I've devoted my career to trying to understand. I think that it is a tragedy that there is such a dispersion in life expectancy based on income. I think the solution that an NIH director, if I'm confirmed, I would fully commit to this, is to address the health problems that lead to that outcome. The rise in obesity, the rise in diabetes,
Again, I apologize for interrupting, but what role does the food industry out there sells a lot of crap to our children, right? And they spend zillions of dollars on advertising products that are really not healthy. What will you do about that?
Senator, I think excellent research to try to find alternatives to make clear the link between the junk food that kids eat and subsequent health outcomes can convince parents, I hope, to make better choices for their kids, to help them make better choices for their kids. I think the role of research is to elucidate those connections and give people tools.
But you're going to have, if you're confirmed, a bully pulpit, so to speak. Would you support what a number of countries around the world are doing in saying to the food industry they cannot do TV advertising for unhealthy foods?
I mean, if I'm confirmed, I would absolutely advocate for to give parents the tools they need so that their kids will eat healthy.
I'm answering the question. Sounds like a good politician here. There are TV ads, as we speak right now, telling kids to tell their mothers that they desperately need some food which is really unhealthy. There are countries who say that those ads should not be allowed on television targeted to kids. Would you support those of us who agree with that?
I mean, if there's a movement to encourage advertisers to not push unhealthy foods, I certainly would be willing as director to say that.
You could lead that movement, not be. Will you help lead that movement?
I mean, absolutely. We want to make America healthy again. I don't know specifically how one would lead such a movement, but I'd be willing to work with you, Senator, to do that.
Thank you very much.